You can't be ashamed of who you are. In my opinion and experience, it has been my greatest superpower, and it makes you the person that you are today.
Assessment of neurodevelopmental disabilities can be very complicated, and symptoms and causes can be very interwoven and difficult to tease apart. That can often require very targeted testing to see what symptoms are best to address and tackle, as well as looking at it from different approaches and different training models.
The Neuropsychology Department and the Center for Development and Learning are looking to collaborate to provide more efficient yet helpful care for patients and families within our departments. So this is the first time we've been able to collaborate together to provide assessments and hopefully really streamline the process for patients and families as they come to Kennedy Krieger.
The patients that are often referred to the Department of Neuropsychology have a wide variety of concerns. Most often we see referrals for attention and learning concerns, as well as mood, so anxiety and depression. We also have patients that are more medically complex that have other concerns.
Keller is a 16-year-old teenage girl who is energetic, outgoing, empathetic, and beautiful on the inside and out. She was very active, always moving, never settled, never calm. Her temper tantrums were epic at times. We tried parenting in an approach that was successful with her older sister. However, anything we did made it worse.
The various clinicians at Kennedy Krieger have really supported me for managing my diagnosis, especially when I was little. They really helped me in behavioral therapy, where I was able to play with toys while being asked questions. And this really helped me not dread visits. And it really helped me come to terms with my ADHD and that it's okay to have these feelings.
I think kids often come in feeling like we are the doctor that's going to give them shots, and some of the spaces that we've had to use have exam tables and they have the equipment on the walls that can be a little bit intimidating, but that is not the type of evaluation that we're going to do with them, so having a space that does not have those things would be helpful.
Currently it feels very clinical. You feel as if you're in a doctor's office, like your child is seriously sick. Having a more comfortable, welcoming examination space would ease everyone's nerves.
By combining our efforts, we're able to combine resources and use them in a much more efficient manner, but provide even more detailed and better care for our patients and their families.
There were a lot of benefits for the whole team to look at Amelia. It was all done in one appointment, so it was a little bit longer, but we don't have to come all the way here multiple times to figure it out. You don't have a long drawn out plan. You know, for 6-8 weeks where you're going to see multiple appointments. It's all done at one. I was really shocked. I didn't know that was the kind of appointment we were gonna have. It really helped also getting everything medication-wise started, talking to the school about getting her plan set up to help her. They discussed everything.
One of the things that I love about Kennedy Krieger Institute is that we have a multitude of specialists under one roof. And when a patient is seen in one department, if they need a referral to another department, it is very likely that that other department is in-house within Kennedy Krieger. One of the problems that we have is that the wait list for each of the departments is very long.
That increases the amount of time patients are having to wait for treatment. And this new model, you can do all of the things, hopefully, that you need in this one appointment, if not within a follow-up appointment. And so that will allow for more efficient and comprehensive care, but also while reducing those wait times too.
One of the most important goals for Kennedy Krieger is to improve access to care for all patients. And this combined clinic, we are streamlining the process from the initial start of intake all the way through diagnosis and then to continued care and recommendations.
Thank you for your support of this very important initiative.
For your generosity.
For being part of my journey.
For being part of Team Kennedy Krieger.
Thank you.